Nothing beats a Jet2 holiday. And right now, you can save £50 per person.
Hi, my name is Dr. Ruben. I'm a board-certified allergist. I hope he's feeling better currently and that he's able to figure out what the underlying cause of his lip swelling is. It's also known as lip angioedema, and there are many potential causes. So if this is something that you've been affected by, or you know somebody, or may need to know about this in the future, save this video and share it with other people. I like to think of angioedema as having two major buckets of potential causes. One is allergic in nature, meaning that there is an abnormal immune response to some type of foreign substance, and then non-allergic in nature, where it's not the same type of mechanism that may be going on. So in the allergic pathway, which is the more common one, you could be exposed to food, drugs, latex, or insect stings, and that can create an allergic reaction that can lead to lip swelling. This is usually driven by the chemical histamine, which causes blood vessels to leak out some fluid, and it leads to that characteristic swelling that happens. If this histamine release is more shallow on bigger tissue, then that's what hives are. So urticaria, which is hives, angioedema, which is swelling, they are actually a continuum, often due to histamine release. There are many non-allergic causes for lip swelling, but they're not necessarily as common. One of the more common ones is actually medication-induced. So if you're taking a blood pressure called an ACE inhibitor, that causes an abnormal accumulation of a substance called bradykinin, which can also cause angioedema as well. Lip swelling can also occur due to infections or procedures that are done. If you get lip filler or some type of injection done to the area, that could cause swelling. Now, doctors, when they're working through the possible diagnoses or differential diagnosis, there are some that you cannot miss because they could be potentially life-threatening. Number one is a severe allergic reaction known as anaphylaxis, where there could be airway compromise with that lip swelling, so you would need epinephrine to treat that. There's also something called hereditary angioedema that can be life-threatening because the swelling can get out of control and you may stop breathing, and that's due to an abnormal accumulation of bradykinin that is due to a defect in C1 esterase inhibitor. And then lastly, this is important, it's rare, but in middle-aged to older adults who have swelling attacks that are recurrent with no family history of this, and there's no itching involved, you take antihistamines, it doesn't work, you have to rule out a C1 inhibitor deficiency that is acquired that could be associated with certain types of malignancies or cancer. And there is some testing that can be done pretty quickly to rule that out, but that is something that is a can't-miss diagnosis in situations like that.